All right. So again, this webinar is being recorded, and I want to welcome you again today to the second webinar on the National Skilled Nursing Facility 5-Claim Probe and Educate Review. On your screen right now, and if you are following along in your slide deck, we are on slide 4, and this is our disclaimer, which we need to give in every presentation. And our disclaimer basically says the information we are giving you today is current and relevant as of today. However, if Medicare changes their laws, rules, or regulations tomorrow, it's your responsibility as a provider to keep abreast of those laws, rules, and regulation changes. It also goes on to basically say CMS prohibits the recording of this presentation for profit-making purposes, but that's why we're recording it for you, and we will be putting this out either this afternoon's recording or this morning's recording, whichever was better. They're exactly the same. We'll be putting it out as an encore to listen to later on, or if you have employees or coworkers that were not able to join and they want to listen to this event after, it will be on our YouTube within the next couple of days. So you have the opportunity to go back and listen again. On slide 5 is a list of acronyms. These are acronyms I may refer to today or I may say, and if I say something that you don't know the meaning of, you can just return here to slide 5 and look up the meaning of that. The last thing I want to say before we get into the information for today's event is if you have questions, please put those questions into the chat feature. Send your questions to all panelists. That way, my assistants, the people that are helping me from provider outreach and education, will be able to see those questions, answer them, or read them off to me if we have time at the end of this call to go through the question and answers. But again, please send those to all panelists so everyone gets the information. All right. My objective for today's webinar is that you, our SNF providers, learn about the probe and educate process that affects all Medicare skilled nursing facilities. And I hope to accomplish this task by going through what's going on, why is this happening, to tell you about who's going to be affected. We're going to talk about when the reviews are going to start, and we're going to also talk about information on how this review process is going to work. So if you're following along, we are on slide 8. If you're following along with the slide deck, what's going on? Well, why is this happening? Well, the Center for Medicare and Medicaid Services, or CMS, has issued transmittal instructions for every Medicare administrative contractor to perform a 5-claim probe and educate medical review on every skilled nursing facility in their jurisdiction. The purpose of this widespread review, which will be implemented in waves over the next year or so, actually began on June 5th. So the purpose is to lower the SNF improper payment rate. As a provider, you should be on the lookout for medical record requests related to this program. So some of the key elements of this program that I want you to know: all MACs that bill the Medicare system are subject to review and are subject to perform reviews on all skilled nursing facilities in their jurisdiction. So each of us as MACs are going to select 5 claims from each of you providers, unless you're already under another review or you're a low volume provider. And a low volume provider means you don't submit 5 Medicare claims a year. So your MAC will complete 1 round of probe and educate for each selected provider instead of our usual 3 rounds that we do in a typical targeted probe and educate review. Education is going to be offered and will be individualized based on your claim error rates that we found. So we're going to put some CMS links in the chat that go to a CMS article on this process, as well as a link for additional resources related to PDPM that are on CMS's site that you might find of interest. So as we move on to slide 9, let's talk about some background of how we got to this point and the root cause for the 5-claim sample. So from 2022 improper payment data reports for skilled nursing facilities, it has been found that the primary root cause of skilled nursing facility errors was found to be missing and insufficient documentation. So how did we get to the need for a review of everyone? And the answer to that is through data analysis. Per CMS, the CERT contractor, the Comprehensive Error Rate Testing program itself for skilled nursing facilities projected an improper payment error rate of 15.1% in 2022. And that was up from 7.79% in 2021. So SNF service errors were determined to be the top driver of the overall Medicare fee-for-service improper payment rates. CMS states that part of the reason for this significant increase in the improper payment rate may be due to the changes from RUG utilization groups to the PDPM, or the patient-driven payment model. And that was for claims with dates of service on or after October 1st of 2019. So during the course of review of SNF error data, the primary root cause of the SNF errors was really found to be missing or insufficient documentation, which we'll discuss more in a little bit. So CMS also believes that the 5-claim probe and educate review is an attempt to increase comprehension of correct billing practices under PDPM by all skilled nursing facility providers that bill Medicare. This allows for us to provide maximum amount of outreach to all skilled nursing facilities and offer some provider-specific education as necessary to prevent further improper payments. So identified improper payments will be adjusted or denied as appropriate, and education is going to be provided. So on the screen in your slide deck, on slide 9, you're going to see a chart listed that indicates the root cause of the overall sample and error category that it fits into, as well as the sample count that was analyzed. So as you can see, almost all of the reasons listed are in some way missing or insufficient documentation. So as we move on to slide 10, if you're following the slide deck, now that you know why it's happening, talk about these reviews are going to happen too. The basic answer to that is all skilled nursing facilities that bill Medicare. The only exceptions will be if a provider is already under medical review by their MAC or by another Medicare contractor, or those providers that are very low submitting providers. So as I said before, those that bill less than 5 skilled nursing facility claims to Medicare a year. How many claims can you expect to be captured in this review? And the answer to that is 5. We, as your MAC, will select 5 claims from each provider to be reviewed on a prepayment basis. We're going to start with the top 20% of providers that show the highest risk based on our data analysis, and we'll continue on a rolling basis from there. We, as your MAC, will continue to add providers probably on a monthly basis, working down the list from those providers with the highest risk to those providers with the lowest risk. So some of you that are larger providers just pose a higher risk because you are larger providers and have more billing. So those are the providers that we have started with. And again, we started on June 5th. All right. Whoops. So the type of review, I've already mentioned this, is going to be a prepay review. That means we will stop the claim from processing. We're going to issue an ADR or additional documentation request. And as the provider, you will have to submit the documentation for review before any additional claims processing will happen. The medical review nurses will then get your documentation and they'll make a decision to either pay at a different rate than what was initially submitted, or deny the service. We will only do post-payment review on a case-by-case basis, and that's only if the provider can prove and makes the request that doing a prepay is going to cause a financial hardship or burden to them. If a MAC identifies an improper payment, we will adjust the individual claim payment as appropriate, in addition to providing education. So including the explanation of denial and payment adjustment. So that will all be included. Again, as your MAC, we may prioritize providers for our targeted probe and educate if all 5 claims that we review happen to be in error. And we'll talk more about that in a little bit. So as we move on, and I'll be on slide 13 of the slide deck, I alluded to the fact that these reviews have already started and that the effective date for this process to start was June 5th of 2023. As I mentioned previously, the first round of providers selected were ranked with those that pose the most risk to the Medicare Trust Fund based on data analysis. Those in the top 20% were selected first, and notifications were made via phone call to establish a point of contact, followed by a letter. So as SNF providers transition through, we will continue down the list in both our J5 and J8 jurisdictions, adding additional providers on a monthly basis. So based on the number of SNFs that WPS has in our jurisdictions, we have a lot of work to do. We have a lot of providers, or a lot of skilled nursing providers that build to us. So this project will continue on fast and furiously all the way through June of 2025. So let's move into how are we going to notify you and let you know that you're up. WPS will actually notify our providers about their selection and the probe and educate process, and we're going to use the same manner in which we notify providers that are under targeted probe and educate process. So the first step of that will be a phone call from us to establish a point of contact at your facility. Once that point of contact has been established and we inform them about the process and that process is going to be starting, we then send out the official notification letter. Most of our providers choose to get that official notification letter via electronic means like email. That way you have it immediately and it's right there in your hands. But we'll also post that initial letter in our provider portal, and you can request that it is to be mailed if you wanted it to come via mail. I highly suggest you get it electronically so you know and you have it in your hands right away. Now, in that letter is the probe number, and that probe number is also the reason code that's going to be associated with the ADR request for those 5 claims. All right. Let's talk about documentation. So how do you know what documentation to submit with your review? And we've actually made that pretty simple for you. First, it's listed in the actual ADR request. So however you view your ADRs, and we hope that you're looking at them through the provider portal, that's the easiest way to get them. That information of what documentation you need to submit is there. It is also listed in our website, and I've linked the exact location to find these guidelines. And here's the breadcrumb trail, and Jennifer has actually posted that into the chat as well. But I am going to show you on our website where you can find that information. Now, I used that linked information that Jennifer posted in the chat, and it took me straight to the article. But let's say you're just coming in for the first time during the day. You're going to want to select your jurisdiction, either J5 or J8, and you're going to want to select Part A. So if you're J5, Nebraska, Iowa, Kansas, Missouri, or J5 National, any other state that bills to us for Part A services, you would select J5A. Once you're there, you'll go to the Topic Center, Medical Review, and we have an article listed right here under the SNF Probe and Educate Review. You can click on that, and you can see all the documentation guidelines will pop up for you. So we need your acute care discharge summary, any transfer information, as well as all of your skilled nursing facility information for that patient. So that includes your admission records, provider orders, progress notes, etc. Everything to support the level of service that you're billing, to support all the PDPM information. Remember, if you are providing therapy, regardless of the dates of service that we requested, to always submit that therapy evaluation as well. So we're going to go back to this in a little bit, but I wanted to show you where to find all of that documentation from our website in case you have to gather the data and you don't have that ADR request letter in front of you. You can go right here and find it. All right. So let's move on. And if you're following along, I am going to slide 16 in the slide deck. And we're going to talk about the ADR, the additional documentation request. So you've heard me say ADR several times now. And if you're not familiar with that acronym, again, ADR means additional documentation request. And this is what tells the claims processing system to halt a claim and not let it move through the drivers to the payment floor until the documentation to support the claim is sent in by the provider, and our medical review department makes a decision and then tells our claims department to manually go ahead and move that claim after their decision is made. So ADR letters are sent via mail to whoever the addressee is listed in the PAYCO system. The ADR letter is also viewable in our provider portal under the letter search. And this is kind of what the letter search looks like. And I know this is blurry, but if you go under the claims tab, you will have the letter search option. If you have rights to view that. Now, you may have access to the portal, but not rights to view that, which means you would have to go to your NPI administrator and ask them to give you expanded access. Okay, so I've said, you know, the letter is sent to the provider. We do encourage you to go through and look at that via our portal. And providers that have been impacted, their reviews have already started, so we really encourage them to watch their billing system. And the things, for those of you who are billers, the things that you want to look for to indicate that a claim has halted and pending an ADR is your claim moves into a status location of SB 6000. The very next day, it moves into the status location of SB 6001, which indicates that an ADR was generated. Once an ADR is generated, you have 45 days to respond and submit all of the documentation to support the services billed. If you don't respond within that 45 days, the system will automatically generate a denial with a 56900 or 56900 denial reason code for no documentation received. Now, these denials are not appealable because there was never a medical necessity decision made on them. They were based on no documentation, so there's nothing to appeal. If there is good cause, like a natural disaster, some sort of interruption in your business practices that, you know, were due to extenuating circumstances that we as your contractor could deem good cause, we could accept documentation for consideration after that 45 days. However, there has to be a good cause for this to happen. So please, once you are notified that you are going to be under review, please take the time to have someone watching your system, watching your claims process, so you know as soon as something requests an ADR that you have to submit. So how do you respond, or how can you respond to these ADR requests? Now, you have several options in which to submit your documentation. The first is via our portal. Let's jump back and look at that article again on the WPS website about the 5 claim sample. And we also in here provide you information on using the portal to submit post-payment claims. So know that that video, that is out there. We try to give you all the information to figure out how to do this and how to do this in the best option. You also have the option, and I'm going to go back to the previous page. Whoops. Let's just go to Topic Center, Medical Review, and responding to a medical review ADR request. So you can go right here and look at all the information about how to respond to a request. Let's say you don't want to submit via the portal. Then you have options to submit via mail. You could copy and print and submit by mail all the hard copy records. You can put it on a CD, DVD, or flash drive and send it protected. We have a password email address where you can send us the passwords to encrypt the CD, DVD, or flash drive. If you are sending it via the mail, either paper or flash drive, CD, DVD, we have mailing addresses for you as well. And even if it's going to come by an overnight delivery service, what the mail address would be. You have an option for fax, and you have an option for ESMD. The one thing I do caution you about is make sure you are in the correct jurisdiction. I am looking at J5. However, if I change this to J8, you will notice I have different options for mailing addresses. So you want to make sure that you are submitting via the jurisdiction that you are practicing in. So J8 is Indiana and Michigan, J5, Nebraska, Iowa, Kansas, Missouri, and all of our national providers that still bill Part A services to us as well. So I just wanted you to note that and bring that up so you could see it. All right. Let me go back to the presentation. And all right. Let's talk a little bit about the review and the decisions. So what happens with the review and those decisions? Our medical review nurses have 30 days in which to review the documentation and make a decision once we receive it. So remember, these decisions could be to pay the claim as it was submitted, to pay the claim at a different level than it was submitted, or to deny the claim. If a claim is adjusted to pay at a different level other than what was billed, or if a claim is flat out denied, both of those are examples of errors and will go against your total amount of error. So we will post individual decisions as they are made to your provider portal so that you can review them right away. That way, if you do plan to appeal, you can do that as soon as the partial pay or denial decision was made. Please don't wait until the end of your 5-claim sample if you have something that you plan to appeal because you still feel it is medically reasonable and necessary, because you only have 120 days from the date that that claim moved to the payment floor and only partially paid or denied to get your first level of appeal into us. After all your claims are reviewed, we will then send you a letter that details your overall results, and we're going to offer education about your overall findings. So if you're following along, I'm now on slide 19 of your slide deck. So if your claim error rate was less than 20%, meaning you only had one of your 5 claims that was found to be an error, you're going to be notified about any widespread education that we'll be providing to help you to continue to be current on the Medicare regulations. You're always going to have the option to request one-to-one education if you so desire. If your error rate is greater than 20%, we will definitely be offering you one-to-one education. So if 2 or more of your claims were found to be in error, we will offer education that will include your claim-specific information and the reason for your errors. I want you to note, though, that CMS can choose to monitor any and all of our one-to-one education that we provide as a third party, and they do that for quality assurance purposes. So we notify them of when education will be provided, and if they choose to be on, they can be on and listen to what we're telling you in the education as well. So when you as a provider accept our one-to-one education, we as your MAC will provide education, again, that includes claim-specific information. So the clinical facts, corresponding denial reasons, etc. And this also allows you as the provider the opportunity to review the claim decisions with us, ask any questions, and receive meaningful feedback that would be conducive to behavioral changes that the facility may need to make, and that will help increase your provider compliance. So if a provider happens to have all 5 of their claims found to be in error, they will also be provided one-to-one education, and you do also have the potential to be prioritized for a targeted probe and educate review. And during the targeted probe and educate review, that means we usually review 20 to 40 claims, and you could go on as long as 3 rounds of review of another 20 to 40 claims in each review set. So again, if a provider has all 5 of their claims found to be in error, then you could be prioritized for a higher level of review. Exclusions. So all of us MACs are making an effort to exclude claims that contain the COVID-19 diagnoses for this review purpose whenever possible. But please note, this is not always possible. If we should happen to need to review a claim that has a COVID-19 diagnosis that fell within the public health emergency dates, which those dates were March 1st of 2020 and ended May 11th of 2023, we will make sure that those reviews are done applying any relevant flexibilities and waivers that were in place during the dates of service under review. And since providers have a year to submit Medicare claims, that is why we could still be capturing claims that have dates within the public health emergency timeframe. Okay, so that is taking us to the end of the formal presentation. So let's review what we've learned so far today. All skilled nursing facilities that bill Medicare are going to have a 5-claim probe and educate review unless they are under one of those exemptions or exceptions. WPS providers will be contacted prior to the start of their probe process to establish a point of contact and explain the review process and what's going on. Education will be available to all providers. Some providers, based on your amount of error, will be offered individualized education. Other providers will be offered more general education. And you're going to start seeing a lot of skilled nursing facility education being offered. So stay abreast of our training page, and I'm going to show you that really quick. Training. And we're going to go to live events. And you can see here that we already have skilled nursing facility coverage criteria scheduled for next month. So August 22nd. There are 2 opportunities to attend that one as well. So you can register for the AM or PM session. So each month going forward, you'll probably see something every month, maybe every 6 weeks. It kind of just depends on the errors that come through. Or you could be routed to some group education that may be happening for a group of providers that all experience the same issues. So stay abreast of that education that we are doing. All right. Again, providers that are found to have high percentage of errors could be prioritized to the targeted probe and educate process. So higher number of reviewed claims, again, that could be 20 to 40. It could be up to 3 rounds of 20 to 40 claims. And finally, we are going to make every effort to exclude that COVID-19 diagnosis whenever possible, but based on the fact that you have a year to submit claims, it may not always be possible, but we will make sure that, you know, any waivers and flexibilities that were in place at the time are utilized in the review process.
Hey, just because you missed the live event doesn't mean your opinion doesn't matter. The QR code on the screen is your opportunity to tell us what you like about this event and what education you would like to see in the future for skilled nursing facilities. So your opinion does matter. Please take this opportunity to take the survey on the encore of this event. You can either scan this QR code from the screen, or in the description of this video, you can find the QR code that'll take you to the survey for the encore event. And now back to our live event questions.
Right now, there isn't any questions in the chat box. However, there was a question this morning in the morning session that might be good to go over. Again, just so for information purposes. The question was, are the initial notification letters under the letter search also? So when we're looking for those notification letters.
No, those letters are not available in the provider portal, but your nurse point of contact can resend a letter to you if needed.
Okay, and again, if you have a question, go ahead and put that into the chat and we will get those questions answered. And then I see a question came in. How does WPS know who to contact at the facility regarding the TPE reviews? We wanted to make sure in case administrators change, etc. So their initial request, they're going to start calling the phone number that you have on file in the PAYCO system. From there, they are probably going to ask for someone in administration, someone higher up, that they can establish that point of contact with. Once they explain to you, hey, this is in regards to the 5-claim probe review that your facility will be under, then your facility can decide who should be that point of contact. I always say it's a good idea to make your point of contact a department name, like administrator or something like that. So in case that person does change positions, they always know, okay, the old point of contact was the administrator, the new point of contact is going to be the administrator as well, or the nurse.
Let's say the director of nursing
is going to be your point of contact. Then you would name that. But we make a phone call. We try to figure out who you guys want. It is a good idea, knowing this is coming, to have someone ready to receive that phone call. And again, we'll keep communicating with them, you know, as we go through the process.
I also wanted to piggyback on that and let people know we will be posting next week a YouTube video that covers how to change that contact person. I believe it's in the portal. So keep an eye out for that. The video title is MAC Medical Review Best Practices, Updating Your Contact Information. And we should be putting that out in our e-news as well, but you can find that on our YouTube channel as well if you don't get those e-news. So I just wanted to let people know that that will be, you know, up and coming, and we'll give you a video instruction on how to make that change if you do need to make that.
Perfect. Thank you, Rachel.
This next set of questions and answers was from the recording from the AM seminar.
Dawson has 2 questions that I thought would be good for the group. They're both involving the letters in the portal. So the question is the 45-day window the date the letter is in the portal, or the date of the actual mail letter received? And then his second question, do we get notification when the decisions are posted to the portal?
Okay, so let's go back to here. And I'm going to go back to that medical review SNF article that's on our website. And your 45 days actually is from the date that that claim moves into the system in the SB 6001 status location. So you can put that date right in here into the medical review calculator, and it will tell you when the end of your 45 days is. So the first day that it's captured, it goes into the SB 6000 location. The very next day, it moves into the SB 6001, and then that's when your 45 days start. So that's why it's really important as providers that once we provide you notification and establish that point of contact, that you have someone watching your claims processing to see when claims have moved into that ADR location of 6001. So you never miss your date. You know, the people that are watching your claims process, they are going to be the ones that know first, you know, what claims have hit and what claims need to be submitted. And then if there's ever any question, you can again take that date when it moved into the SB 6001 status location, plop it right in here and hit calculate, and it'll tell you when the end of your 45 days is. And Rachel, was there additional parts of that question?
Yes, but do we get notification when the decisions are posted to the portal? And I believe the answer would be yes, and you did just go over that, but that was the second half.
Yeah, when the decisions are posted, they go into the provider portal, and then you do that through your search into the provider portal as well when those notifications are there. So again, we really encourage you to watch those decisions, you know, watch your provider portal. You're going to be able to find exactly what the reason for if a claim was only partially paid or denied, what the reason was for that, and then affords you the opportunity to start the appeals request if you believe that your claim is still medically reasonable and necessary after the review decision is done.
All right, so our next question is from Vicki, and the question is, how far back will these claim reviews go, current month? So yeah, do we have a date for how far back we'll be going for these reviews?
Sure, and the claim reviews are prepay reviews. So as you drop those claims into the Medicare system. So we're not, unless you have specifically requested a post-payment review because of financial hardship, these will be claims that you're dropping now. So you have 1 year from the date of service to bill your claims to the Medicare system. So when it's your time for the review process to start, it will pick 5 claims as you drop those into the system. So they'll be whenever you put those in within the last year.
All right. And then next one is from Marilyn, just a clarifying question. Will this be for Medicare A claims or A and B both?
No, so this process is only for those skilled nursing facility Part A claims. So we are only looking for, people that are in your skilled nursing facility in a Part A state.
All right, and then a final one is from Amy. do you look at the ICD-10 coding in reviews? So for example, a different diagnosis was billed on the UB versus what was submitted on the MDS, but the PDPM code is the same. Would this be a rejection? And this may be a medical review question on those reviews, but.
Okay, I'm just looking at Amy's question. Do we look at the ICD-10 coding in reviews? And if it was different than what was billed? Yeah, we do. And Amy, let me kind of just give an overall of, you know, what goes into the review. So we do need to verify that what is documented and what is billed match. So when the reviewer does a review of a skilled nursing facility claim, they are looking to see that the level of service that was billed is actually what's captured in the documentation. So if there's an ICD-10 code for a diagnosis that's on the claim, we're going to make sure that that ICD-10 is also captured in the documentation. So diagnoses, that word just left my head for a second. Diagnoses may change or be added as a patient is in a skilled nursing facility stay, and we would expect that the documentation also continues to be updated, you know, as diagnoses change or added, et cetera. So we will look at the PDPM codes. We will make sure that they match what's captured in the documentation and that the services continue to be medically reasonable and necessary throughout that person's stay in the skilled nursing facility.
Linda, you did a great job answering that. I just want to clarify too that while if there is a difference in the documentation versus what is perhaps on the MDS or the face of the claim, if it does not change the PDPM code that is billed, you will receive education versus an error being assessed. So errors will be assessed if it results in a change to the HIPS code bill.
Perfect. Thank you, Linda. So I hope that helps. Amy says thank you. Yes.
All right. So I just want to address Cindy's question, and then we also got another one from a different Amy that I will read. But Cindy's question, when I go to the first link on WPS's website, SNF 5 Claim Probe and Educate Review, I get this message. You currently have a jurisdiction J8B selected. However, this page only applies to jurisdictions J5 and J8A and J5A. Does this mean it will not provide to our providers? And yes, that is correct, neither for Part A SNF claims. So the next question,
bring that up, Rachel.
Yes.
So again, when you go back into our webinar, if you only are a Part B provider, Part B being physician billing or outpatient services, the skilled nursing facility reviews that are being done are specific to those Part A stays in the skilled nursing facility. So yes, you'll have to select your jurisdiction. It will be under Part A. And again, if you go to the Topic Center for Medical Review, then you'll be able to find that information since it's specific to the facility type of review. All right, go ahead, Rachel, I'm sorry.
No, it's good. And it's good you have this up. So the last question we have in here, is there a specific list of codes that will be included in this review specific to SNF coding?
So no, there is no specific list of codes. It will be for the 5 claims sample will be based on claims that are submitted for any kind of skilled nursing facility stay. So it is not specific to any one type of code. It is not specific to any block of service or any month of service. These could be any 5 claims that are skilled claims that you bill for any of your beneficiaries. Again, we push the survey because it is so important for us to get that feedback from you and to know, especially going into this process, what you guys need from us to make your review successful. So, you know, please take the opportunity to take that survey for us. And with not seeing any other additional questions come in, so on behalf of Jennifer, Rachel, and myself, and all of Provider Outreach and Education and our Medical Review Department, I want to thank you for participating in today's event, and you may now disconnect.